Good morning, good afternoon, good evening, everybody. So this is international webinar. We have a pretty busy schedule today. We have seven speakers and talks, and our agenda is first Dinggang will do a brief introduction of all the talks by the summary slides, and then we do the talk one by one, and the attendees can raise the questions on the Zoom webinar interface, and the speakers can handle those questions maybe by typing the answers to minimize the interference of the talk. If you have additional questions, probably we can discuss that offline or send emails to the speakers. So, Dinggang, it's yours.
Okay. So the title for this MICCAI webinar is Imaging AI-based Management of COVID-19. And this is co-organized by Tianming Guoyan with me. And we also have the 5 technical support committee, Jing, Hui, Guang, Qian, Dong, and Sihui for all the work. And this is basically MICCAI support organized by MICCAI Society and also mixed in China, and financially supported by Shanghai United Imaging Intelligence. Actually, before this 4-day webinar, we already have preparation for the this webinar on May 9. We have 2 one-week talk, 2 1-hour talk. The first one, which is my one, and I talk about integrating AI in imaging, quantification, and identification of COVID-19. And if you are interested, this is a video in YouTube and Bilibili. Also, Shiyuan talk about deep learning on images and graph, and he also mentioned the apply of this technique to COVID-19. So basically today, we are going to have 7 20 minutes talk, and tomorrow we are going to have 8 20 minutes talk. And in the next couple slides, I will show how the full stack imaging AI can be applied to the COVID-19 applications. So basically, AI can be used for contactless imaging to protect the technician from infections by COVID-19. And although after we acquire the images, AI can be developed for quantify infections. All the infections quantified can be used for assess the severity. I will talk one by one very briefly in the next couple slides. For the contactless imaging, actually, this is like a traditional or conventional imaging workflow. Technician had to be with the patient, and then technician also need to adjust relatively positions between patient and X-ray tube. In this way, it's very possible to have close contact between technician and the patient. In this way, technician may be exposed to virus. So there's one technique called contactless imaging. Basically, you have 2 rooms, one room for patient, another room for technicians. And in the top of the room, there's a camera we call the air camera. Air camera not taking the images for the patient. And also basically the air camera can match each body parts, means it can recognize where is the chest area, then you can scan. Next, just show you very brief video, for example, when the AI identifies the patient, then can control the scanner to move. And then, image will be scanned exactly on the area you are interested. For example, chest area for the COVID-19 case. So after acquired images, actually patient is still on table. The technique like AI is developed to automatically quantify the infections. So there's a lot of methods have been developed. Actually, we did we have invited review paper for IEEE reviews in biomedical engineering, and we summarize all the papers by May 31st. For example, 67% of papers use UNet for segmentation, 22% of papers use UNet plus, 11% of papers use VBNet. All this method is used to segment long, also segment long lobe, and also more papers used to segment lesions or infections. So here is a basic, method people use, for example, try to use deep learning algorithm to segment not only infection, here is the infection area in the lung, although they want to segment the left lung, right lung, and 2 lobes in the left lung, and 3 lobes in the right lung, total 5 lobes, and also in the whole lungs, try to segment 18 segments. Actually, there's a lot of innovations that can be developed for these applications, particularly if you want to segment infection should be within the lung. And also if we want to segment lobe, the neighboring lobe, like middle lobe and the bottom lobe, they should be constrained. In the conventional algorithm, we just develop, for example, dice ratio to measure segmentation for each lobe separately. In this way, bottom lobe can be segmented on the top of the middle lobe if you don't have any constraints between them. So there's a lot of innovative loss function can be identified. Basically, you can identify the closing, information between the neighboring lobes. And also when you develop deep learning algorithm, particularly in the initial stage, you don't have a lot of manual labeled infection and also this long images. So in this way, a technical code like human in loop means AI algorithm and human build a loop, then they can help each other. In this way, it can iteratively increase the size of the training data, basically apply the previous trained network to the new data set, and then radiologists pick some of them for manual collection. And those collect samples are included into the training data and try to help all the segmentations. So this kind of technique can be used to segment infection, and also can use it to segment left lung, right lung, then you know infection in each lung. And also, as I mentioned, you can segment 5 lobes, infection in each lobe. Also, you can segment 18 segments, then the infections in each segments. Also, more importantly, we can do the component analysis for infections. As you can see in this figure, we have 4 different parts for the histogram of the infections in each segment or each lobe or left, right lung. So the origin area actually corresponding to the GGO. This is one of the important imaging biomarker for COVID-19. And also technique can be used to do longitudinal comparison. If you segment infection from current image, and also you segment infection from previous images. Basically in China, for example, for the patient in the hospital, they scan the subject every 3 to 5 days. Then you can compare the infection, for example. Here is a component analysis. You have the histogram for the infection in previous time point, and you have the current time point infection distribution. So this distribution moved to this left side means the healthy side for the lung, and that means the lung is recovering for the subject. And also, after you acquire images, then one important thing is you want to do identification, severity assessment, and prediction. For example, after you acquire the images and the patient is still in the CT and particularly on the PT table, then before sending this CT to the radiologist, the algorithm can do this kind of questions. For example, where the current subject has COVID-19 or CAP. CAP stands for community-acquired pneumonia. And of course, this is very important task. You can have one algorithm to do that. If this subject has COVID-19, then next questions you want to ask, actually physician will also ask where this patient is mild or severe. You can develop a second technique to answer these questions. Then if this subject has mild cognitive, their question is where this subject will progress to severe or not progress to severe. With all this kind of AI-based diagnosis, you can better manage patients. Means how can you treat them differently or put them in the different hospital for different special treatment. So actually a lot of technique developed in these directions, as also shown in our review paper. 60% of papers actually use the CT and 40% of papers use the X-ray. And 50% of paper answer questions where the current patient has COVID-19 or no COVID-19. And 43% of papers asking the questions whether this subject has COVID-19 or other pneumonia. So 7% of paper answer very difficult questions to try to assess the severity for the COVID-19 subject. And also in terms of method, 86% of papers use deep learning, 14% of papers use a traditional machine learning algorithm. And also for the performance of all this method, actually 43% of papers got a percentage of accuracy, like 80 to 90% of accuracy. Over 57% of papers got over 90% of accuracy. So this is all the papers actually published by March 31st this year. So today, actually, we are going to have 7 talks. I will talk them very briefly, and let the speakers spend more time talking about their method. So first talk will be presented by Dr. Shiyuan Liu. He is elected chairman of Chinese Society of Radiology in China. So he's going to talk about the role of AI in COVID-19 clinical decision making. So that means, for example, AI can reduce the burden and improve efficiency. And also, as I mentioned, the AI can be used to do the diagnosis and also longitudinal follow-up studies. So the second paper will be presented by Zhiye Wu from United Imaging Intelligence in US, Boston, US. So he's going to talk about countless patient positioning for the CT imaging. Third paper from Dr. Bai, actually from the Brown University. He's going to talk about if a physician is using AI or without using AI, whether using AI can improve the diagnosis. For example, can identify other pneumonia for the from the COVID-19. So number 4 paper actually will be presented by Dr. Ye from Korea. So he will talk about the deep learning algorithm, try to do the identifications using X-ray images, and he will talking about mainly for the small data set, like how to develop algorithm to solve the small data issues. And the number 4 papers will be presented by Hayit Greenspan from Israel. So she basically developed a method to segment all the infections from the image, and then using a quantitative way, like relative score. For example, you have more infection as a 1, less infection, for example, 0.51, or no infection 0. So this is a method he is going to talk about. And then Dr. Yang from New York. So he will talk about method he developed in Nature Medicine. This is a paper, this paper accepted by the Nature Medicine. He's talking about not only using CT images and also using non-image information. For example, for clinical score, blood testing, and all other information. Then where integrate this information can improve the diagnosis of the COVID-19. So the final papers for today, actually Dr. Xinggang Wang from Guoyan Zheng University of Science and Technology, actually from Wuhan. So he worked basically, he started, work very early in January, early February for this work. So his method basically say, okay, if you have the CT images, I want to do the diagnosis. But in the meanwhile, I also want to segment, lungs using unsupervised segmentation. Then all the features used for diagnosis can be getting from the segmented lung. Also, in the meanwhile, this algorithm can automatically estimate lesions in the CT. So this is like a lesion localization. So these are all the papers, and also I very briefly mentioned, for example, if people are interested working on the COVID-19, and we do have the special issues you can concern. This is a special issues in the IEEE medical imaging. I'm a leading guest editor for this, and maybe this is one of the first special issue on COVID-19 in the engineering journal, and also working with Tianming and also other colleagues. And we have the second special issue in the medical image analysis. And the third one actually in the pattern recognition. This will be announced very soon. So then today, like I mentioned, we have 7 talks, and the first talk will be presented by Dr. Shiyuan Liu. As I mentioned, he is elected chairman of China Society of Radiology, and he is also director for radiology department in Tianming Hospital in Shanghai. So Dr. Liu, I will stop sharing, and then you can just share your screen and start to present your work.